As parents, we get so much joy and excitement out of watching our children take on all of their milestones, from sitting up to rolling over, crawling, and walking. But truly, there's nothing better than hearing our child's first words. But what if those precious milestones seem to be delayed? If you found yourself worried about your child's speech development, you're definitely not alone. Speech delays affect between 5 and 10% of preschool-aged children, with boys being 3 to 4 times more likely to be affected than girls. But here's something that might surprise you. The root cause of many speech delays could be linked to events that happen during birth. Today, we're going to explore an often overlooked factor in speech delays and introduce to you a groundbreaking approach that goes even deeper than speech therapy and OT to fully address the root cause of speech delays. This video will be especially powerful for families who are already perhaps trying many months or even years of speech therapy and have seen some great improvements and gains, but have plateaued or not progressed at the rate and level they're really looking for. In this video, we'll be discussing the surprising link between birth interventions and speech delays and how neurologically focused chiropractic care can address the root cause of these delays. You'll learn about a holistic approach that could complement or even enhance traditional speech therapies. In our practice, we've seen countless parents struggling with their child's speech delays. They've often tried various therapies and interventions, but the progress is slow or inconsistent. What many don't realize is that speech delays can often be traced back to birth trauma. When we dive into the case histories of our patient population struggling with speech delays, well over 80 to 90% of them have some documented birth interventions, such as forceps, vacuum extraction, C-section, or induction. Studies show that birth interventions like forceps, vacuum extraction, and C-sections, which are widely used in a significant number of deliveries, can potentially cause physical trauma to an infant's delicate upper neck and brainstem area. This trauma can lead to neurological dysfunction and alter the function of the nerves and muscles that control and facilitate speech. The first point that I really wanted to talk about is how birth intervention trauma creates subluxation and neuromuscular dysfunction. The physical twisting and pulling that happens during the different birth interventions leads to something called subluxation, which is a misalignment, fixation, and neuromuscular interference or dysfunction. These subluxations, particularly in the upper neck and brainstem area, can affect the nerves and muscles crucial for speech production. And here's why all of that matters. Number one, the nervous system controls everything in the body, including speech development. Subluxations can interfere with the proper function of the nerves responsible for speech. And traditional speech therapy, while really valuable, may not address these underlying neurological issues because their exam and assessment does not look for them. Now, when we talk about speech and how it's formed in the brain so that words come out, it's really a 3-step process. First, there's the perception or input into the brain. Second, the brain and nervous system must integrate or coordinate that input. Then lastly, there is the output or the expression of that speech. Now, subluxations can interfere with each step of that speech formation, including the first two, which is why it escapes traditional medical and therapy assessments. So with speech delay challenges, it's not just a muscular or structural issues. While traditional speech therapy looks at speech delays as almost a muscular dysfunction, muscles are under control of the nervous system. So the tone and coordination of the nervous system matters massively. Additionally, many providers today blame tongue or oral ties, but even those are first caused by subluxation and tension or stress on the nervous system. This is why so many parents report to us that after doing traditional speech therapy, even maybe doing a tongue or oral tie revision, their child still struggles with speech delays. So how can we help? Well, the first step is to finding out how we can help a child with speech delay is diving deep into their case history. We find things like a stressful pregnancy, birth interventions and trauma, difficulty latching and nursing, torticollis, pagiocephaly, chronic ear infections, and so forth. We become extra confident when we can help. We utilize our neurological insight scans, which helps us locate and find subluxations in that kiddo's nervous system. This information and scan findings, then we create a personalized and customized care plan for that child. We sit down with you and go over the results and report our findings visit. So, Are you looking for help for your kiddo and their speech delay challenges? And you maybe also already tried speech therapy and OT and seen some great progress with your kiddo, but they plateaued, and you're really looking for that true optimal healing, then give us a call or send us a DM. We would love to help your kid thrive and get to the root cause of their speech delays, removing those subluxations. So thank you so much for watching, and make sure to live in harmony.